making sure children are healthy, safe, loved, ready to learn, succeeding in school and in life. This is Our Children, a program brought to you by the Children's Trust.
Good morning. I'm Charles Auslander, President and CEO of the Children's Trust.
And I'm Ileana Varela with the Herbert Wertheim College of Medicine at FIU. And together, we welcome you to Our Children. The Florida legislative session began this week with a new projected shortfall in revenues, resulting in a lot of folks, including child advocates, scrambling for their slice of the pie.
So today we're going to talk about policy issues, pending legislation, and funding for children's health, early childhood education, and the state's continuously embattled child welfare system. Let's get started, shall we? Joining us now are Senator Rene Garcia, Chair of the Health and Human Services Appropriations Committee, and Diana Ragbeer, Director of Public Policy and Community Engagement at the Children's Trust. Thank you for being with us.
Thank you.
Good to see you. Senator, we'll start things off with you. The 5-year waiting period for legal immigrant children who want to apply for low-cost health insurance through KidCare still exists in Florida. I know you've not given up on eliminating it, and 29 states already have. So what's the latest on this so far that you can let us know about regarding the session?
Well, thank you for having me here. It's a great pleasure to be here and being on the panel with Diana. And I'll tell you, look, it's been a battle that we've been at the Children's Trust, we've been fighting for the last 5 years?
5 years.
5 years. And finally this year we got it through the first committee of reference. And the ultimate goal is to try to make sure that we cover these children that previously were not able to get any health insurance because they had that 5-year waiting period that the federal government mandated the states to implement. The feds have backed away from that policy, and I think it's incumbent upon the states now to do the same thing, to follow suit, to make sure that we get these children. And when we started this process a couple of years ago, Diana and I were talking right before the show, the Department of Healthcare Administration came back and they scored this at about $500 million cost to the state. And now it's down to
4.8 million, which is
Wow.
the correct figure,
Wow.
which we've known all along.
A slight difference.
just a little bit, just real small, and that money's going to go a long way to cover a lot of children in our state, and I think we'll get there this year.
Well, aside from the math problems, Diana, why do you think this has been so difficult to achieve? Is there still confusion, perhaps, between the definitions of what constitutes a legal immigrant child and what an undocumented child who is here illegally is? Has that been part of the problem, you think?
That most certainly has been part of the dynamic, particularly for some of our members in Central and North Florida. So we wanted to be very clear in the legislation this year. We put in 2 places in the bill that nothing in this legislation applies to undocumented children. It also does not apply to adults. We're talking about children of green card holders, parents who came here legally, who bought the house, who work, who pay taxes. Their children are in school with our children. And there's no reason for these children who are going to end up getting this health insurance anyway to have to wait for 5 years. By then, they have missed all their well child checkups, all the preventive measures that we could have taken. It's then that we discover the heart murmur and things that
Sadly.
could have been prevented. And we want to keep these children in school and keep their parents working. So I do think having those definitions and that language very clear will dispel any fears and myths and discomfort that some members may have had, and that's how we ended up with a unanimous vote last week.
So it may have come down to semantics playing a big role in that.
The money and the semantics.
That's right, but we got there.
Amazing.
Senator, I'll take you from one critical policy issue to the next. Florida's reluctance to expand Medicaid. That would cause a significant hole in the state budget, and I'm wondering if you can talk to us about what you think the consequences are for our community.
Well, The real consequence that we have at the state budget right now, it has to do with the LIP, the low-income pool dollars. Right now, that money is about, the federal government last year gave us an extension for a $2 billion program that is due to expire this year. And that money is used to subsidize hospitals for uncompensated care and for also some payments to managed care entities for primary care. And that money is set to expire this year. The federal government has been very clear that they don't want to expand the program as it is in its current form. Yet the state of Florida has been very reluctant to expand Medicaid. And if you were to expand Medicaid, you wouldn't need those supplemental payments for the uncompensated care at our hospitals, especially during the ER visits. So that's the state right now is working with the federal government to come up with a solution to the crisis that we have before us, because it could potentially be a $2 billion hole in our state budget. And if you look at our community, the ones that will be impacted the most are institutions like Jackson. And the hardworking men and women of this community who will not have access to health insurance because of the state's legislature's reluctance to expand or to at least look at another form of how to access the $50 billion that are waiting in Washington, D.C. to come into the state to provide health care for so many people. So
it may be a very hard question to answer, and I apologize for that, but you are a senator.
Oh, thanks. Make it easy on me, come on.
No, Senator, not at all. But do you sense a certain optimism that there's a way to unentangle this challenge, or?
Well, I think this year with with having this potential shortfall of this $2 billion not coming back to the state, I think it shows, it lets the House of Representatives know that it's a situation that needs to be taken care of. I think the Senate has had a couple of proposals in the last couple of years where we are willing to take that step, and we need a partner, and that partner needs to be the House of Representatives. I really truly believe, as a Republican, I'm a staunch fiscal conservative, but when it comes to taking care of our families and taking care of our children, especially when there is the Florida taxpayers' money is in Washington, D.C. waiting to come into the state, how dare we play the political game of saying, no, we just don't want to accept this money for political reasons. I think now is a time for the House of Representatives to come up with their plan. It doesn't have to be the Senate's plan. It could be their plan, and come to the table and have the Republicans and Democrats working together to make sure that we access this $50 billion that are waiting to come into the state of Florida.
Real quickly, Diana, children with disabilities are particularly vulnerable. I understand there's a program that serves them. Early Steps is called, that also needs funding. Can you tell us about that?
Yes. The Early Steps program is a wonderful program which provides early interventions for children with developmental delays, children ages 0 to 3 who might have cognitive, vision, hearing, difficulty with fine motor skills, walking. And there are therapists that come into the families' homes and help these children so that they're able to be ready for school and to succeed in school. And we had a shortfall the past few weeks that we found about in this current fiscal year. And Senator Garcia was able to help us recover $4.2 million that was going to be lost in that program. And a lot of advocates and parents and providers all banded together, and under Senator Garcia's leadership, we're able to recover that money,
Wonderful.
Making a lot of families very happy. But I have to tell you that we need to get that money increased again for next year. The program
wonderful news nonetheless.
Does have challenges.
Now, Senator, we know you have a lot on your plate in appropriations, so don't go away, because we're moving on to the child welfare system when we come back from our break. And then later on in our program, we're going to show you what's happening in this year's Young Talent Big Dreams competition. So don't go away.
Someday, he'll own his own company. She's going to have a career in graphic design. And believe it or not, future pediatrician. And so that your kids can succeed tomorrow, the Children's Trust is investing in them today by supporting hundreds of programs and services dedicated to helping kids and parents. To find a program for your child or learn more about what we can do for your family, log on to thechildrenstrust.org or call 211. The Children's Trust, because all children are our children. It's not about the classroom or the computers or how much money you make. It's not where you live or where you come from. When it comes to kids succeeding in school, the #1 factor is
me.
Moi.
Yo.
Parents like me and you.
If you want to make a difference in your children's lives, read to them, be selective about their care, encourage them to get good grades. You have to be active and involved. To find the support you need, log on to thechildrenstrust.org. The Children's Trust, because all children are our children.
Welcome back. We're talking about important issues to watch this legislative session. Joining us now is Jackie Gonzalez, CEO of Our Kids of Miami-Dade and Monroe Counties. And still with us are Senator Rene Garcia, Chair of the Health and Human Services Appropriations Committee, as well as Diana Ragbier, Director of Public Policy and Community Engagement at the Children's Trust. Jackie, welcome.
Thank you.
Good to have you here. Last year's child welfare bill resulted in a significant funding increase for a variety of things, in particular the hiring of additional qualified child protective investigators to keep more children out of harm's way. But how has that impacted organizations like yours?
Well, it's had a very significant impact. One of the byproducts of that is that we've had more than 60% increase in the number of kids coming into care. So stated differently, that means that we're caring for an additional 1,000 or so children every single day.
Wow. Remarkable.
So that has put stress on the system, not just the case managers who are carrying a lot more cases. The judiciary has doubled the caseload, the guardian ad litem, the lawyers handling the cases. The entire system has been overwhelmed by the increase in volume.
So I'm going to open up to the rest of you. Obviously, this was a start. This was necessary. But this has opened up a whole new can of worms, because now she's overwhelmed. Her system is overwhelmed. Now what do we do? What are the next steps that we need to take in order to address the issues that have come up because of the first steps that we took towards addressing the problem?
Well, I think we started to address the crisis in the child welfare system, but it was in part. We need to come back and finish the job by funding the back end of the system. So in the interest of protecting children's safety, we are removing more children, but where do we put them? And we do have to pay for that. So Jackie's exactly right. We have to fund the community-based care agencies, such as Our Kids, so that we do have the funds for those children. They are going to need resources, and we're going to have to fund that. We have to pay for the remaining pieces.
It was an unintended consequence of, and I say unintended consequence just on the financial side. I think it's worked out well with the passage of Senate Bill 1666.
I mean, this is what you want. This is the outcome you wanted. I mean, you wanted to address the issue.
No, absolutely. I mean, we want to see as less. We don't want to see so many children in custody, but the fact that we are getting them in custody and getting them out of harm's way, that's our #1 role.
Right.
But agencies like Our Kids are now overwhelmed with having this influx of kids into the system, and now what we have to start doing is making sure that we fund the system properly to have so those kids can have a permanent home. I think the idea before was the issue of reunification of the family. One of the issues that I've always thought it's more important than the reunification is permanency, finding a permanent home where that child will be safe. I don't want to see a child go back to a home where they're abusive or a home where there's drug usage and so forth. And I think agencies like Our Kids and what Jackie's doing is an extraordinary job at trying to make sure that they find a permanent home for these children and make sure that they're out of harm's way. And I think it's incumbent on the legislature now with the advocates to work together to find new funding sources or new funding streams to make sure that we are able to put these children in a safe environment.
And Jackie, continuing on the Senator's points about safety and permanency, which are really critical, the Senate President has called for I think essentially a complete review, Senator, of the mental health funding system in the wake of a very tragic incident where a father with a history of mental illness threw his 5-year-old off a bridge in Tampa. And you've been on the front lines for a long time and administering for a long time. What is your experience with respect to the mental health circumstances and how they relate to child welfare?
Well, we see often that not just the mental health issues, but domestic violence, drug addiction, those are typically factors that are co-occurring in the cases that we see, and that can affect the ability of a parent to provide the necessary care for their children. So it's really important that we look at the whole issue, and not just the one incident perhaps that's being called into the hotline, but the family functioning and how that may affect the caregiver's ability to care for the child. So it's a very significant problem that is beyond that one incident that the call to the hotline is about. Right. You have to take a very holistic view, a family view.
And that's such an important point that you're making, that it takes time, doesn't it, to really get into these issues with families and really work through them and to achieve that permanency outcome.
Absolutely. It takes a lot of time, a lot of work, and with the influx in the children, and the Senator's right, we want the kids to be safe, and the kids that we see coming into care need to be in care because there are lots of concerns with the families. So it's a good thing, but we want to make sure that we have the resources so that the system can then provide the necessary solutions and strategies, because there are no quick fixes. Very few of them are quick fixes. They are long-term in nature, and you want to provide the best services possible. In order to do that, you need the resources. Well, Senator, you're the one who's been tasked to make this top-to-bottom review, what a task it is. What's your take?
Look, I'm glad that Senate President Andy Gardner has taken a serious look at the issue of mental health and substance abuse in the state. And one of the things that I think everyone on this panel realizes, especially those in the child advocacy world, is that a lot of children are coming from a lot of children with issues, or children that are taken away or come into the state's custody. The basic cause of all these issues, it's either a mental health or a substance abuse issue, and domestic violence, coupled with domestic violence. So we need to start taking a holistic approach and look at how we comprehensively fix the system. And when we had our last committee here, when we had a hearing, and it was just dedicated on mental health and substance abuse, but more on the mental health side, I asked everyone in the audience to raise their hands. And I asked them, how many of us know or have known someone that's had a substance abuse issue? Almost everyone raised their hands. And when I asked the question, how many of us have known or know of anyone that have a mental health issue, almost every single hand rose in that room. So the first issue that we have to start addressing is, how do we start eliminating the stigma associated with mental health or substance abuse before we can start treating the individual and getting the individual out of the darkness and into the light and taking care of them. If we can take a holistic approach, not only of the individual but of the system, we'll save money on criminal justice, education, in our police, and our healthcare and the delivery of healthcare. So we need to start now. This is a time to do a comprehensive overhaul of the mental health system in the state of Florida.
Senator, we've run out of time. We're going to have to take a break, but Senator Jackie, Diana, weighty issues, and we certainly appreciate you taking the time to work on them and to share it with us today. Thank you very much.
Well, thank you.
Thank you.
Up next, we're going to talk about the safety of our children in childcare and a whole lot more, including how to get your kids into the hottest talent competition in town. You won't want to miss that, so stay with us.
Daycare, childcare, babysitting. It may not matter to you now, but it should. When you're on the job, your children are either learning or not. So before you drop your children off someplace on the way to work, think about whether that place is going to prepare them for the future. Find a star-rated childcare center near you by visiting thechildrenstrust.org. The Children's Trust, because all children are our children. It's not all about the school, or the teacher, or the neighborhood you live in, but those books on the shelf will open many doors when you open them up and read to your kids.
Read.
Lee.
Lee. Read to your kids.
Let them read to you.
Because when kids read, we all succeed.
To learn more, log on to thechildrenstrust.org and click on Read to Learn. The Children's Trust, because all children are our children.
Welcome back. Advancing early childhood education and child care policy are always at the top of our list. And still with us to talk about those priorities is Diana Ragbier. So Diana, historically, there's always a long list of families waiting for subsidized child care. But we hear that there may be good news from Tallahassee this session.
Thank you, Charles. We're hopeful. The governor proposed an additional $30 million for children on the waiting list to receive subsidized child care. This is to allow their parents to go to work. And we currently have a waiting list in Florida of about 48,000 children, 11,000 of whom live in Miami-Dade. So we do need that additional money, and we're hoping that the legislature will take the governor's lead and provide that additional money on a recurring basis every year.
We touched on this, Diane, already, which is an area of major focus right now, which is keeping children safe from abuse and neglect in their own home. But obviously, keeping children safe when they're in a child care facility setting is also very important. What's happening this session on that front?
Yes, we've heard cases of children being left unattended in vans and things of that nature. So the legislature has a very strong bill, the Child Safety Standard Bill. It failed in the last day of session last year because of unrelated issues, but we're pushing it hard this year. It's going to increase penalties, and it's going to require certain family child care centers to be licensed. It's going to require that providers post Class 1 violations, those are the most serious ones, in a conspicuous place for parents to see. It requires additional training of some of their personnel. So overall, we're increasing the safety standards in child care centers.
So many issues with child care that you've ticked off. Performance-based pay, another issue that's really at the forefront. It's been percolating in the past, but it's at the forefront now, isn't it?
We're inching closer to that. We have always wanted to weed out the bad actors and to reward the providers that do a really good job, and so we want to provide increased payments for those providers. So the legislature funded a pilot program last year, and we're in year 2 of the pilot, to actually fund with additional monies for those providers that have additional trainings and do additional things that would bring them up to a higher level of quality. The goal being that we would end up paying for performance, and that's really what we need to do to have high quality amongst all our providers in the industry.
You know, a lot of times when we talk about issues and solving problems, and we end up talking about money, some people will say just throwing money at a problem won't necessarily solve it. Do you believe that there has to be more than just providing funding for example, for these child care facility issues?
Yes, I think there's professional development, there are good curricula, there are good policies that need to also go hand in hand with funding. You can't do one without the other. So good policy, adequate funding.
I do think that performance-based pay for quality care is just one of those things that you're talking about. It's because it isn't only about money. It's about more than money.
Obviously, there has to be a lot of education involved in the child care setting. A lot of the cases where we see even tragic situations, a lot comes down to training, doesn't it?
Absolutely. We do find that there's special child development training, age-appropriate training that's required and can be very helpful. And so we would like to see the industry increase its standards and have professional development courses for all of the child care providers. And that's something the Children's Trust has been doing on its own for quite some time with our Quality Counts program. We're very proud of that, and we're hoping that the state of Florida will continue and do something very similar.
Why don't you tell us about that, about how the Children's Trust has been involved in this from the very beginning?
And I appreciate Diana referencing that, because quality child care is a major issue for us. It's a major issue for the Early Learning Coalition locally, and together we put in excess of $10 million a year now to really try to improve the teaching environment in early childhood centers, and also the education and wage standards for child care staff. Such a critical issue nationwide, but certainly a major issue in South Florida as well. So all of those things put together really can improve the quality of child care.
And I think I think one of the important things is also parents being able to access the proper child care center, and I know that when the Children's Trust puts out the guide, there are places there for parents also to check out the right child care center, so thank you for that. Well, it's obviously going to be a very busy session for everyone up in Tallahassee.
Indeed.
Diana, good luck.
Thank you.
Thanks for your work, and best of luck in Tallahassee.
Appreciate it.
And to keep up with what's happening, regularly visit the advocacy page at thechildrenstrust.org and sign up to receive the weekly Capital Connection newsletter during session. And now on to the biggest talent competition in Miami-Dade. Young Talent Big Dreams got off with a bang last month. Here's how it's shaping up.
I'm feeling nervous a little bit.
Just telling myself that I'm gonna do great. I feel kind of good, so I got this.
Young Talent Big Dreams.
We are expecting kids between the ages of 8 and 17 to bring us their performances. I have to tell you, we are so very excited. It's about the kids having an opportunity to take a risk, to try something new.
I've got my eyes, no they don't see as far now.
So the Children's Trust decided to partner with Actors Playhouse for Young Talent Big Dreams because we thought it was a wonderful opportunity to come together and create an opportunity for kids to, in many cases, appear on stage for the very first time. And because this is a free competition, it opens the doors to a lot of kids who might not ordinarily have that opportunity.
My name is Jeremiah Paul. I'm 12 and I'll be dancing in the individual dance category. I made my own choreography. I love dancing because you can express your feelings.
This event, Countywide Youth Talent Contest, not only gives children a chance to audition and increase their opportunities to show their skills, gives them a chance to realize that if they work hard for something, they can really reach for a goal. That goal may be becoming a performer, better lawyers, better doctors.
Hello, my name is Brenda Mederos. I want to become a surgeon.
We have seen so many terrific things come out of this. So many kids have gotten other opportunities. Some of the prizes are wonderful, and it just grows and grows and grows every year, and we are thrilled to be able to do this and to be able to continue doing this.
Come audition.
Young Talent Big Dreams.
So if your child or teenager can sing, dance, play a musical instrument, compose original music, or spoken word, register them for an audition right now. Just visit actorsplayhouse.org. It's free and the prizes are amazing, so do not miss out. I'm Ileana Varela on behalf of the Children's Trust and Charles Auslander. Thanks to all of you for watching this special edition of Our Children. Enjoy the rest of your day.
Our Children is brought to you by the Children's Trust. The Children's Trust invests in programs and services that help make children healthy, safe, loved, ready to learn, succeed in school and in life. To access its funded programs and services in Miami-Dade County, visit thechildrenstrust.org or call the Children's Trust helpline at 211, because all children are our children.